Welcome to episode 2 of the Spill on Women's Health Plus. Today we are going to be talking all about pap smears, and our guest is Pascale, who is a doctor. She is also a performer, melanin queen. I'm sure you have seen and heard Mary before, and she's also a lecturer at the All Saints University. She will be giving us all the deets about pap smears and letting us know all that good stuff from her perspective as a doctor. So it is episode 2 of the Spill on Women's Health Plus, and we are talking to Pascale today. Let's talk about, first of all, what is a pap smear and why is it so important for women to get one done? Okay,
the thing is, like anything is, when you don't know what you're going to do, when you don't have an understanding of what is going to happen, you're really scared. And I think that you're doing a very good thing here, educating women on those type of tests and screening. So when they get to the doctor's office, they have an idea, they're not surprised, everything goes well. Now, what is a pap smear? It's actually a screening test. Just like when you go and get your blood work for anything else, it's just a screening test. It's done through a procedure. So you're going to take some cells from the cervix. We're going to talk a little bit about that. From the cervix of a woman, and you really want to see, are those cells healthy? Because we can see when the body is healthy. When you have a pimple, you can see what's going on with your skin. But if nobody really checks what's going on inside, a lot of women can actually go on without knowing that there could be an issue. Now, the funny thing is the name is from the staining that is used, Papa Nicolau. And I think nobody had time to say Papa Nicolau every time. We just wanted to say, you know what, Pap, keep it simple. Now, what we do, of course, when the woman gets to the doctor's office, we explain everything. And I did a few pap smears when I was in medical schools, and it was actually cool. And I think many women, after having one pap smear done, they're not scared anymore. Okay. So what we do, we use a speculum. The speculum is like a device, it looks like a bird's beak. So it's just like this. And yes, women always feel like, oh, can it fit? Of course it fits if we're giving birth. Of course, a little speculum will fit, okay? It's not as big as my 2 hands together, okay? But we have this little device, and it's really there to keep the cervix open so that we can access it. But the real test is what? We take a little brush thing, very tiny, like you see for those who do makeup, those brushes that they use for the eyebrows.
Right.
This is
like
how,
your spoolie.
Yes, this is how small it is, even smaller. And we just take, it can be done with that brush or with a little thing that scrapes. It's not a big scrape, okay? Don't look at those, don't hear those words and start getting scared. But we just take a few cells from the cervix and we put those cells on a blade. And the blade is like I should say, a transparent kind of flat surface. We're going to prepare that sample and send it to the lab so that we can observe it. So the whole point here is to get some cells. You have 2 parts in your cervix, the outside and the inside. So we want to get samples from both sides and see, okay, what's going on? Is everything healthy, etc.
When we talk about this procedure, inserting the speculum and getting that sample of the cervical cells, how long would you say on average that procedure takes?
I would say it depends on the experience of the practitioner. Fortunately, nobody was like, random people don't just go around, giving pap smears. Right. So most times, it just takes a few minutes. We're not even talking, because I don't want to limit it, but just to allow the woman to settle, relax, get her legs up, insertion of the speculum, etc., the collection. I would say under like 5 minutes. When somebody knows what they're doing, it's just whoop, whoop, whoop. Move on. Right. So, and it's not painful. It's not, the woman just feels discomfort because you're in a very quiet room. Right. You're in a quiet room and you feel like, okay, everybody's just there watching me. Right. But it's not anything to be scared about. It's really just, if you're relaxed, that's fine. Like it goes well.
In my experience too, 5 minutes I would say is ample time for us to be over and done with a pap smear. And what you're saying about the practitioner is, and the experience is also very true, because I've had times where it was a little more uncomfortable than other times, and it's all to do with experience. So my current gynecologist, she goes in and out in a jiffy, and I don't even know, the pap smear is over. I'm like, that's it?
Exactly.
Right. So sometimes people are kind of wary of the test, but it's all to do with, I agree with the practitioner sometimes, and how quickly it can happen, but it's not painful. I do agree with that. It's just uncomfortable.
But I feel sometimes in our mind, it's just really, you're not in the usual position. Like, you have a pap smear done during business hours. During business hours, you're not in that position, But in other activities, you may have assumed that position.
Right.
So it's not to say it's a very uncomfortable position where you don't know what's going on. It's just that it happens in a very formal setting with somebody that you may or may not know. If it's the first time you're doing a procedure with that doctor, etc. But the aim from the other side, the aim is really to make the patient comfortable. And if the patient is really relaxed, it goes so quickly. Like, before you know it, you're done, you're like, okay, thank you, see you for the results,
Right. Checking those cells of the cervix to see if they are healthy. So I want to get into that a bit. When we talk about they being healthy, what are we really looking for with that screening method that we use in the pap smear? What can we see with those cells? Okay,
basically, your entire body is covered by what we call an epithelium. And based on where you are in the body, you have different shapes of cells. So for example, on your skin, the epithelium is very flat. We call it squamous. Flat and in many layers. Now in your stomach is a different epithelium based on what the stomach is supposed to do. In the rest of your GI is the same thing. It changes because of the function of that part of the body. And your cervix has the same, it follows the same rules. So you have the outside of the cervix is closer to the outside of the body, which is the skin. So it tends to look more like the skin. So flat cells, very stratified or layered. And on the inside, it gets a little taller, like almost like a square shape. Now, what you want to see is anytime the body is sick, you have a change in the cells. It's almost like the cells get very disturbed. Sometimes the nucleus, which is the center of the cell, it gets bigger compared to the rest of the cell. So just think about it. Anytime the part of the body is diseased, those cells are going to act up, if I can say that. And this is one of the things that we observe a lot with cancer. Cancer is basically cells doing what they want. They're not following the genetic code. They're not following the instructions of the body. They just say, you know what, today we want to multiply, let's go. And with cervical cancer, because that's what we use pap smear for, to screen for cervical cancer, you have actually a particular presentation of cells. And based on, because you have this cell in the nucleus, based on how big the nucleus gets compared to the normal cell, you can actually grade what's going on. And that's why we insist that pap smear should be done. There are regulations, but you want to actually do a pap smear as early as possible, so that if there's a change, you can address it right away. And what you want to see is how much variation we have with those cells. If you do see a mild variation, then you can still, address it and take care of the female's health, etc. But when it's really advanced, a lot of times there's not much you can do. And because we go into those kind of micro levels, micro anatomy levels, it's so precise that we see the slightest changes, So it's so important. It's really important for women to get in touch with that.
And cervical cancer, just that term, it sometimes creates fear in women. Cervical cancer, of course, is a fairly common cancer type, and it occurs in women of reproductive age. And so a lot of women, because I did a study when I was doing my master's in public health on women's attitudes and knowledge about pap smears. And a lot of women, from what I found, felt that the pap smear was to strictly tell them whether they had cervical cancer or not. So what you're speaking about, which is this ability of the test to catch mild changes or small changes even before a cancer diagnosis, that is something a lot of women were totally oblivious to. They felt it was like a test to just determine whether they had cancer or not. And
I do think that's why a lot of women stayed away, because it's
right.
like, I'm not trying to find out if I have cancer, you know, let me get sick and I'll deal with that. And this is a real fear. Many women don't go to the hospital or to the gynecologist because they are scared to find out the results. For a thing as simple as pregnancy, women are scared to find out for various reasons. And just imagine, you know, pregnancy is not a disease, it's just a change in, you know, body physiology. But imagine if we test and tell you if you have cancer or not, you're like, you know, I almost don't want to find out. Right. But it's just like, again, I always use, when I explain that to women in general, I always say, it's all about finding out how healthy you are, you know, in your reproductive system, just because you can't see. You can do face care, you can do skin care, right. Nails, everything. Even the breast, you can actually figure out, you know, doing your breast examination, you can figure out what's going on. Right. But it changes on the inside, you can't just see. And your husband can't see either, he doesn't know.
He doesn't know. Right.
A lot of those changes, and that's where it gets very bad, because by the time an inside change becomes like a seen outside, sometimes it's too late.
It's too late. What does that mean? What does a bad result mean? Or what can it mean, I should say?
Okay. Now there are different, like I said before, there are different degrees of, I would say, bad results. It could be very, very mild. Meaning we usually call it dysplasia. Like you can see a change in the cell. It's not very bad. It's like almost like a beginning change. Or it could be on the other end of the spectrum, like severe. So the first thing to do not panic, because usually when the doctor said doesn't give you a result on the phone, you already start to think, oh boy, it's going, it's not good. Right. And you start to roll all my rosary and do all much things. But the first thing is not to panic, go to listen to the doctor. And the good news about it is you can actually address those changes. Like the very mild changes. Once you're not at the level of, you know, once you're not beyond repair, like cancer, and even with cancer, you know, medicine is very advanced these days. Something can be done. But early stages, what can you do? It's as simple as doing what we call a cryotherapy. Like you kind of freeze the cells that are abnormal. It's sometimes weird when you talk to people about this, because they're like freezing the cells. It is very simple. You get rid of those cells, and you know, cold temperatures or very hot temperatures can actually disturb the progress of cells. So that's the whole thing behind it. You can also use electricity. There's like a type of not to plug yourself in somewhere, no. There's a type of, we call this loop excision. But you use electricity just again to destroy the abnormal cells. You can do a cone biopsy. So at that time, yes, you know there are abnormal cells, but you also want to see what's the extent. Because of course, during the first pap smear, we took a sample of a certain area. So if we see abnormal cells, not just to say, you know, let me take care of those cells and not look around. Right. You know, so you do a bigger biopsy in the shape of a cone that you're going to study further. But the fewer the cells, the better it is. The abnormal cells, I should say, the better it is when you start to take care of it. So not like all hope is not lost when somebody has a bad result from a pap smear. And the best thing that, the next thing that is important is to continue to follow up. So your doctor is going to complete the procedure to get rid of abnormal cells, but you have to follow, you know, the advice, which is you repeat the pap smear maybe 6 months down the line or in a year, etc.
Right. And it is such a tricky thing, actually, to deal with the abnormal cells and to make sure that they don't reappear. I can speak very openly about the fact that I've had pap smears that showed cervical dysplasia, and I've had to have cryotherapy. As a matter of fact, I've had it done twice. And in that process, you would say to yourself, okay, so I'm getting rid of the abnormal cells and maybe, you know, that's it. But there is the possibility sometimes that it can reoccur. That's why you have to keep checking and follow up with your doctor. As we said, you may need to repeat the pap smear. You need to just make sure that everything is is clear, as we would say. Make sure that everything is clear.
So to me, the pap smear should be done at the gynecologist's office. There are a lot of gynecologists. Wherever you're watching from, wherever in the world, there's a gynecologist close by. But it should be done at the gynecologist's office. And I think that before going into it, even before speaking to the gynecologist, a woman or a young girl who is considering it should go to a service like Women's Health Plus. Just have that conversation. Now, I mean, it's recorded and you're going to watch, but there are more questions. And the most important thing is when you step into that doctor's office, you need to be relaxed. You need to know that this is for your own good. So yeah, I do believe, you know, get to Women's Health Plus. They need to see you and discuss this further. And also, different people have a different liking. I'm sure you probably know the gynecologists around town, and you can guide them. Now, your other question was, how do we go about it? I send it back to you, you know? Because it helps when you have had some kind of advice. So you get to the office and you're like, okay, I'm ready to have a pap smear done. And the gynecologist understand that, you know, you had a discussion with somebody, they put you in the right mindset, and you're going to just relax and allow them to do their work.
So the gynecologist, for sure, and I do appreciate that you mentioned that I can't advise and refer, because I have had experiences that are so wide and varied in the medical service arena. The public health system too, pap smears are offered. Some people are more comfortable doing it with their private practitioner, but in the public health system, in the clinics, and also at the Dominica Planned Parenthood Association. The last thing I will ask you is if there is any myth or any sort of, I keep talking about fear, but if there's any myth or anything that you've heard brought up about pap smears that you want to just settle the score on right now, you can let me know what that is, because I am all about dispelling myths and putting clear information on there. So if you heard anything that you want to clarify, that you've heard people say and you're like,
I know. When you're actually on the testing side, it's like, oh my gosh, you cannot be serious with this stuff. I've heard so many things, but on the top of my head, once somebody felt like we're taking a picture.
Oh.
Like, this is really real stuff. Like, the patient came and is like, yeah, I heard y'all take pictures. I'm like, what picture? You know, and I think it came from the fact that, you know, when you see a lot of, like, because the hospital here is a training hospital, a teaching hospital. So you see the gynecologists with student doctors. So you feel like, oh, it's a crowd and somebody's probably documenting this. And I'm like, listen, this is not even the case. Like, honestly, as a student, when you send me to do my pap smear, the last thing I'm doing is a picture. Like, I'm just trying not to fail the scores here. Like, I am focused, I am placing my speculum, I am making sure my hand is not shaking away. This is not the time for pictures, for a fact. No. Another myth is people think that you actually remember what the inside your vagina looks like, and I'm like, how? Imagine a person looking at vaginas for the entire day. Like from 8 to like 4, you're just looking at vagina. How will I remember? And it's funny because there was a woman who we had a procedure. It wasn't a pap smear on her, but it was a surgery. And when I was doing my gynae rotation, and she remembered us. Or my surgery rotation, she remembered us. But we couldn't, I didn't remember her. But it was kind of a miracle thing that all the scans showed that she had cancer. And then when we went in, we didn't see anything. So she actually remembered everybody on that medical team. Like, from the time we started taking care of her, her cancer just disappeared. That's how she felt. Like, we were a blessed team. Where was I that time? I went to church in Vegas. And the lady's like, yes, I remember you. You don't remember me? I'm like, yes, no, I don't. She said, yeah. And she started to tell me what's going on. And I'm like, oh, yeah, I remember the case. And that's what people need to realize. Doctors try not to associate the face too much to what they say, because they're not trying to judge you. You know, we absorb so much information that I don't want to see Trudy on the road and remember, oh, Trudy, dysplasia, cryotherapy. No, I just want to say, hi Trudy, what's going on? Where's the food? You know, where are we meeting to drink something? You know? So we don't remember all this stuff. We probably remember the case. If it was really a cancer and how it managed it, that's remembered. But not the face and all that stuff.
I don't know what's the word I want to use. I am just surprised at your myth about people thinking that you are, as a medical practitioner, that there is memorization of the vagina of all these people that have to be seen. So ladies, you're listening to the spill on women's health. We're talking pap smears. The doctor or the nurse who is doing the pap smear is not trying to memorize what you have going on down there. So feel free to get your procedure done without being afraid of somebody judging your genitalia. So I feel like we have spoken a lot about pap smears. I hope that some of the fears that people have about getting it done, or some of the concerns that people have, were kind of addressed in this video. But of course, if not, they can always reach out to me for further advice and for further education around the process. I hope that if somebody listening has not gotten a pap smear and they are sexually active, that they consider now, trying to get one done. You heard it from MP, Dr. MP, the melanin queen, Mary Pascale. Just let's have it done and have a good time. That's what she says. I think that's it, Mary. Thank you so much for sitting with me on the spill. And I do hope that sometime we could have you again. I mean, I'm going to be doing this every month, and we're going to be talking all the deets on women's health issues. And so I'm sure we'll get to link up again. But I'm so happy that you agreed to be my guest here on the spill, and it was great. It was
awesome. Thanks for having me, Trudy. I think what you're doing now, bringing awareness to all those women issues, that's so important. Because, the gynecologists, obstetricians, they do their work at the office, but, educating the public is so important. So I appreciate that. I've watched the spill before, so I can't see myself on the little TV.
Hey guys, my name is Trudy Christian, and I am the owner of Women's Health Plus. Thank you so much for watching this episode of The Spill. If you liked this episode, and I am sure you did, please make sure to like and share so that your friends can also get to view The Spill. We will be coming every month with new and interesting topics about women's health. So The Spill is something you definitely need to look out for. So remember guys, like this video, share it, and keep on the lookout for more of The Spill on Women's Health Plus. Thank you.